German child soldiers braced for execution. Americans brought them hamburgers instead. Music, somber, epic orchestral score with a slow, driving percussion beat begins and fades slightly under the narration. It burns when you touch it. German woman POW's hidden injury shocked the American soldier. The year is 1945. The 1,000-year Reich, a nightmare that consumed a continent, is finally collapsing. The air over Germany, once thick with the proud roar of the Luftwaffe, now rings with the relentless advance of Allied armor. Every village, every ruined city is a tombstone for Hitler's desperate dream. In the chaotic aftermath, a different kind of prisoner moved through the dust and rubble: German women, members of the Wehrmacht auxiliary forces, Signal Corps, and anti-aircraft units. They were soldiers, drafted by the desperate hand of a dying regime, and now they were simply survivors. Our story centers on one such survivor, a young woman named Hilde Schneider, an anti-aircraft Helferin from Berlin, captured near the shattered walls of Leipzig, and the man who found himself responsible for her, Sergeant Frank Miller, a medic with the U.S. 9th Infantry Division, a man weary of war, whose hands knew the difference between a wound and a casualty. The place was a makeshift holding center, a cold, echoing warehouse outside of Kassel. The prisoners were lined up, a silent, gray tableau of defeat. Sergeant Miller's job was triage, checking for infectious disease, for hidden weapons, and for injuries that could fester into tragedy. Miller moved down the line. Most prisoners were sullen, exhausted. Hilda, barely 20 years old, stood out only for the unnatural stillness in her eyes. When he reached her, the official order was simple: examine for immediate medical needs. "Your name?" Miller asked, his German slow and careful. "Hilde Schneider," she replied, her voice flat, the sound of shattered glass. He checked her wrists, her neck, the superficial cuts and bruises of battle. Then his eyes fell to her left hand. It was kept tight against her side, hidden beneath the thin gray tunic. He reached out to check it. She flinched violently, a sharp intake of breath, the first flicker of emotion he had seen in her. "What is it?" Miller asked, his medic's instincts overriding the professional distance. "Show me your hand." Hilda hesitated, her gaze locked on the concrete floor. Slowly, reluctantly, she pulled her hand free. It was not a combat wound, not a shrapnel tear or a bullet graze. It was something far more insidious, something domestic, yet utterly shocking in the context of a prisoner of war camp. A severe, deep chemical burn. The skin of her palm and fingers was raw, discolored, weeping. Miller's blood ran cold. This was not a fresh injury. It had been left untreated for days, maybe a week. An infection was already setting in, a living rat creeping up her forearm. "How did this happen?" he demanded, his voice low. Hilda whispered, barely audible. "It burns when you touch it. It was cleaning solution, acid." The raw medical urgency forced a moment of trust. Miller led her into a small, relatively sterile office and began the laborious process of cleaning the wound. The pain was excruciating, and Hilda bit her lip until it bled, but she did not cry out. As he worked, cutting away the dead tissue, swabbing with painful antiseptic, he pressed her for the truth. This was not the kind of wound a soldier gets on the battlefield. Finally, the story spilled out, a quiet torrent of shame and resilience. Hilda hadn't received the injury during the final battle for Leipzig. She had received it 3 days before her capture, working a grueling auxiliary shift in a military laundry depot. In the chaos of the collapsing infrastructure, an untrained assistant had mixed 2 caustic cleaning agents incorrectly, a terrible, blinding splash. The injury itself wasn't the shock. The real shock was the cover-up. "I tried to report it to the officer," Hilda confessed, her voice thick with residual pain. "But he said we were already short-handed. An injured hand was not a bullet wound. They gave me a scrap of old bandage and told me to get back to the flak tower. I was told a sick woman was a luxury the Reich could not afford." For 3 days she had stood on the flak tower, the immense concrete anti-aircraft tower, manning the massive 88mm guns, tracking Allied bombers, her left hand burning, weeping, hidden beneath a dirty sleeve. She fought with an untreated 3rd-degree burn. She knew that if the wound became visible, she wouldn't be sent to a hospital. She would be put to hard labor, or worse, deemed a malingerer and executed under the draconian final orders of Hitler's inner circle. The pain, she realized, was a badge of survival. She had hidden her wound not out of defiance to the enemy, but out of fear of her own side. Sergeant Miller finished bandaging the hand. The gauze was pristine, the antibiotic ointment thick. The contrast with the filth and neglect of the German system was stark. He called in the camp's senior medical officer, Captain David Doc Stern, a hardened veteran from Brooklyn. Doc Stern examined Hilda's hand, the look on his face a mix of professional diagnosis and profound disbelief. "Sergeant Miller, this is a miracle she hasn't got full-blown septicemia," the doctor said, shaking his head. "Look at the depth. This is a life-changing injury if it doesn't get grafts. and it needs IV antibiotics now. How long did she say she carried this? 3 days, sir, while on active duty in an anti-aircraft battery. Captain Stern stared at Hilda, a German soldier, a young woman who had just confessed her valor was forced by the cruelty of her own commanders. Valor or desperation, Doc Stern muttered. In the end, what's the difference? She kept fighting. It's hard to imagine Miller fighting our boys without pain. Miller looked at Hilda, who was avoiding their gaze, her face set in a pale mask of exhaustion. Sir, she's a POW, but first she's a patient. She's coming down with me to the field hospital. This was against protocol. Auxiliary forces were usually processed separately, but Miller had seen too much. He had seen the German system destroy its own people with fanaticism and neglect. This young woman was not a monster. She was a victim, covered in the dust of the collapsing world she had been forced to defend. Miller stood his ground. Captain, the infection risk is too high. If this turns gangrenous, we lose her, and we lose the hand. She needs a clean bed, surgical assessment, and IV drugs now. I'll sign the transfer order myself. Hilda was transferred. For the first time in months, she slept in a clean cot under a wool blanket. The field hospital, a world of American efficiency and noise, became her temporary sanctuary. Sergeant Miller visited her daily. He wasn't trying to interrogate her, he was checking his patient. He changed the dressings, cleaned the wound again, and watched the angry redness slowly recede under the powerful push of penicillin. During those daily visits, Hilda began to talk, not about the war, but about the before, about the compulsory service, about the drab reality of the flak towers, the endless, deafening terror of the Allied bombing runs over Berlin. She spoke of the fear of the Gestapo, the fear that transcended the fear of the enemy. She recalled a moment just hours before her capture. The final order had come to her unit. Fight to the last man and the last bullet. Surrender is treason. She remembered looking at her bandaged, festering hand and realizing that her own survival depended on breaking that order. She saw the American lines advance, and she dropped her rifle. I thought you would shoot me, she told Miller one afternoon, staring out the window at the liberated German countryside, or put me in a dark cell to starve. I expected your own version of the cruelty we knew. Miller, a man whose primary goal had been to kill the enemy, found himself in a strange, intimate corner of the conflict. He was not a warrior now, he was a healer, treating an enemy who had been more injured by her own masters than by his bullets. We're not them, Hilda, Miller said, his voice quiet. We're soldiers, but we're also medics. We treat the wound, not the uniform. Hilda's physical healing was steady but slow. The burn was so deep that she would require a skin graft later, likely leaving her with limited use of her hand. But the infection was beaten, the pain was receding. More profound was the psychological shift. In the American field hospital, she experienced a profound truth. She was valued as a life, not as a weapon. She was given food, care, and a small but vital measure of respect. Other German POWs were brought in, men and women. Sergeant Miller and Captain Stern treated them all. The American soldiers, hardened by years of brutal combat, saw the same pattern repeat. The wounds of the war were often less severe than the wounds of the regime. The injuries were physical. The tragedy was the wholesale destruction of morality. One day, Captain Stern came into a room with a civilian woman. It was a German-American social worker working to trace families. Hilda, Doc Stern said, a rare smile on his face. We found your sister. She survived the bombing of Hamburg. She is ready to take you in when you are released. Hilda didn't speak. She only nodded. The tears finally came. Not tears of pain or fear, but of an overwhelming, fragile hope. Miller was there. He saw the transformation, the shell of the German Helferin finally cracking, revealing the terrified, resilient young woman beneath. He saw her face the future, not with the fanaticism of a defeated soldier, but with the quiet resolve of a survivor. A few weeks later, Hilda was fit for transfer to a general POW camp, from which she would eventually be released into her sister's care. Her hand was heavily bandaged, but her posture was different. She had reclaimed her dignity. Sergeant Miller met her at the gate. Well, Hilda Schneider, he said, you're going home. She looked at him, at the tired, decent face of the American medic who had seen her at her most vulnerable and chosen to heal her. She hesitated, then extended her good hand. Miller shook it. A firm, simple gesture of respect. Thank you, Sergeant Miller, she said, the words clear and genuine, for treating the injury that my own side forced me to hide, for reminding me what it means to be a person. Miller watched her walk away, a thin, determined figure moving toward a new, uncertain peace. He thought of the impending burn, the injury that shocked him not because of its severity, but because of the neglect it represented. It was a physical manifestation of the moral rot of the Reich itself, a system that demanded total sacrifice and offered only a grim, uncaring fate in return. And he realized that in the midst of a war fought to destroy evil, sometimes the greatest act of valor was not the firing of a weapon, but the quiet, simple act of healing a hand.